If you look at a map of India's tribal belts, the geographical isolation is immediately apparent. Here, in the Mahisagar district of Gujarat, the town of Santrampur sits far removed from the state's major urban hubs. For decades, if a medical emergency or a complicated childbirth occurred in this region, local clinics simply didn't have the equipment to handle it. Families were forced to travel hundreds of kilometers to metropolitan centers like Ahmedabad or Gandhinagar for basic emergencies. In trauma and critical obstetrics, the first 60 minutes after an event are known as the golden hour. When your nearest major hospital is a 4-hour drive away, that critical window for survival often closes while the patient is still on the highway. In 2017, Dr. Ranjit Singh Joja and his team opened Ashokbhai Hospital in Santrampur. It was an attempt to bring city-level medical infrastructure directly to the tribal heartland. Building a fully equipped facility in a medical desert did more than just provide local jobs. It closed a deadly gap in proximity for a community that had been medically marginalized for generations. Dr. Joja focused the hospital's mission on reversing the national trend toward surgical births, a trend that has become increasingly commercialized in private healthcare. Since its inception, the maternity ward at Ashokbhai has successfully facilitated over 11,000 normal deliveries. Ashokbhai's 14.90% C-section rate is a fraction of the private hospital average, and in March 2026 alone, they recorded 60 successful VBACs, a rarity in private practice that proves a first C-section doesn't guarantee surgical births for life. To maintain these low surgical numbers safely, the hospital uses German fetal monitoring technology. This gives the medical team a safety net, allowing them to track a baby's health with precision to encourage natural labor even in complex cases. This means mothers in a remote tribal belt are receiving the same specialized care found in metropolitan centers, delivered within their own community. By prioritizing natural biology over the higher profit margins of surgical births, the hospital is demonstrating that private healthcare in rural India can thrive on a model of medical necessity. The hospital soon expanded beyond maternity care to offer localized emergency services, comprehensive blood diagnostics, and family health counseling. A major milestone was adding a localized CT scan facility. This provides a critical diagnostic tool previously unavailable in this region of Mahisagar. The quality of these services has led to a shift in medical tourism. Instead of villagers fleeing to the city, patients from Mumbai, Indore, and Ahmedabad are now traveling hundreds of kilometers into the tribal belt to seek Dr. Joja's expertise. This influx of urban patients validates the hospital's medical quality, effectively turning a rural outpost into a destination for specialized care. Bringing this level of technology to Santrampur means the difference between a village and a metropolitan center is no longer measured in the hours it takes to get a life-saving diagnosis. Row 320 of this government data confirms Ashokbhai Hospital is an officially impaneled PMJA facility. This backing allows tribal families in the Mahisagar and Santrampur regions to access private-tier medical care without the threat of financial ruin. This impact has been recognized by the local Ayushman Bharat Award and the World Record Office in the UK, which cited the hospital for its high volume of normal deliveries in a tribal area. Today, the hospital's legacy is found in the thousands of mothers who experienced safe deliveries and the children whose lives began securely because they didn't have to spend their first hours on a highway. The success of Ashokbhai Hospital shows that world-class care isn't a privilege exclusive to the city. It is a standard that can be established in any remote village through a dedication to medical necessity.